As a dermatologist, hair loss is something I treat in my office every day. So here are some of my favorite treatments and tips that I recommend. I'm Dr. Nina Desai, a board-certified medical and cosmetic dermatologist and mom of 4, and I want to help you find solutions to your skin concerns and share a little bit about my life. Before we get started, make sure to subscribe and leave a comment below with skincare topics that you want me to make videos about in the future. So when I'm diagnosing hair loss, it's really important to understand exactly what the reason that someone is losing their hair is. So first, I like to break hair loss down into what's happening on the scalp. Is this hair loss what we call scarring or non-scarring alopecia? And alopecia just means a general term for hair loss. So in this video, we're going to focus on what's called the non-scarring alopecias because those are the ones that are more common. When I look at a scalp and I think that someone's experiencing a non-scarring alopecia, there's a few things I look at. How much hair do they actually have on their head? And how much hair is actually shedding or falling from the hair? The most common type of hair loss is actually what is known as androgenetic alopecia, or male pattern and female pattern hair loss. So when a man comes into the office and they're experiencing male pattern hair loss, what you're going to notice is that there is what's called bitemporal thinning and thinning at the crown of the scalp as well. When a female comes in, what you're going to notice is that they're having this widening of their part, and you can actually see more of their scalp. Women will oftentimes notice that there's less hair in their ponytail when they go back to put their ponytail in, and both men and women will notice that there's just increased shedding in the shower or on the pillow. Another type of non-scarring hair loss that I see often in my practice is what's called Telogen Effluvium. And Telogen Effluvium is your body's stress response. And these are the individuals that are going to experience this intense shedding of your hair. So it's important to understand the phases of the hair growth cycle in order to understand what's happening in Telogen Effluvium. So first we have anagen, which is the growth phase of the hair. Next we have the catagen phase, which is this transition phase, and then we go into the telogen phase. The telogen phase is what's known as the resting phase. The telogen phase will last about 3 months, and then these hairs will shed. It's actually normal to lose about 50 to 200 hairs a day. It's when you notice more intense shedding, over 200 hairs a day, that we then say maybe this is what's called telogen effluvium, or when you have more hair in the telogen phase and it's falling out more rapidly. When it comes to telogen effluvium, which is your body's stress response, there are a lot of different factors that I ask about to determine if this is what's happening. There can be either physical stresses or emotional stresses that will push your body into telogen effluvium. In terms of physical stresses, I always ask if there has been a recent surgery or a recent illness or a new medical condition, new medications that you're on, if you've been pregnant or had a baby recently. These are all things that can actually bring on telogen effluvium. The emotional stressors can also bring on telogen effluvium. So I always ask about recent deaths in the family, hardships, job situations, emotional situations that actually are trying on your body, because that can really trigger telogen effluvium as well. When I see a patient in the office and I think that they might have telogen effluvium, I'll perform what's called a hair pull test. So I will grab onto their hair and just gently tug and see how many hairs prematurely fall out. And then I'll know if they have an excessive amount of hairs that are shedding in the telogen phase. And when I perform this test, I always let my clients know that I'm not actually pulling their hair out. I'm actually just gently pulling the hairs that are already in that telogen phase that are already going to shed. So I just rest assured tell them that they are not going to lose more hair if I'm doing a hair pull test on them. So the biggest factor that determines if you're going to develop female or male pattern hair loss is your genetics. And I always tell my clients to look at their entire family. There are a lot of myths that say, look at your mom's dad or your uncle or whatnot, but it's actually your entire genetic pool as a whole. So if your siblings have thinning hair or hair loss, you might be more predisposed or inclined to develop androgenetic alopecia. For all types of hair loss, I always do a complete workup just to rule out any other underlying causes of hair loss. There are some medical conditions that an individual will have that can actually trigger hair loss as well. And these include certain vitamin deficiencies or autoimmune deficiencies as well. So when you're doing a complete workup for hair loss, it's important to have some basic blood work done as well. So if you're experiencing hair loss or hair thinning of of any type, it's really important that you go see your dermatologist because we can help you diagnose the type of hair loss that you have, and then we'll lead you down the correct treatment path. The important thing that I tell all of my patients about these types of non-scarring alopecia is that if there are still viable hair follicles, we can help them regrow. That's actually different from a scarring alopecia. A scarring alopecia, when the hair follicle is scarred down, we actually cannot regrow that hair. So it's important to understand the distinction between the two. So my first tip to all my patients with hair loss is try to reduce your stress level. I know that's easier said than done, but in the case of a situation like telogen effluvium, where this is your body's stress response, you really want to make sure that you're reducing all the stresses in your life. In addition, when we're dealing with telogen effluvium, I'll always let my patients know that this is what's called self-limiting. This shedding or this excessive shedding will stop on its own. It may take several months or it may take 1 to 2 years to stop on its own, but it will. You will not lose all your hair and you will not go bald. Androgenetic alopecia is a little different. It is what's called a progressive type of hair loss. So because of your genetics, we can't stop androgenetic alopecia from happening, but what we want to do is we want to slow down the progression with the treatment options that we have. So once you've diagnosed the type of hair loss that you have, let's talk about the treatment options. So for both of these types of hair loss, the treatment options are pretty similar. So there are a few things that I'm going to recommend that you do at home, and then there's some options for us to do here in the office as well. So at home, I will recommend the tried and true minoxidil to all of my patients. Minoxidil 5% has the most data and the most research out there on helping to thicken and regrow hair. Minoxidil has been used in both the oral and topical forms for many, many years. And how it was actually discovered is that minoxidil is a blood pressure medication that doctors noticed when their patients were taking it for their blood pressure, they were actually regrowing their hair as well. But not only on their head, but hair elsewhere as well. So with oral minoxidil, we do need to be worried about hair growth in other areas, and that may not be the most desirable result for some individuals. Enter topical minoxidil. So topical minoxidil works on the scalp and works really, really well. I always recommend the 5% minoxidil, which is the one for men, but I recommend it to my female clients as well. And I recommend using it every single day. What minoxidil is going to do is it's going to help retain a lot of those hairs in that growth phase, and it's going to help with the circulation on the scalp as well. So you will notice that with consistent use, the hair looks thicker and fuller. I typically recommend using minoxidil for about 3 months before you're going to start to see the results. I have been using minoxidil on and off for years. I've developed telogen effluvium multiple times with multiple pregnancies, and it takes about 3 months for that to really start to kick in, but it really does help. With androgenetic alopecia, using Rogaine or minoxidil is something that you have to do consistently because, as I mentioned before, we're not stopping your genetic predisposition for androgenetic alopecia. We're trying to slow it down. And if you stop using the minoxidil, you're going to revert back to where you would have been genetically. Another medication that I do prescribe in my office for my clients to take orally is spironolactone for my females. And what spironolactone will do is it helps to reduce some of the androgen production or the male hormone that will contribute to the female pattern hair loss. Spironolactone can be very effective in female pattern hair loss, similar to the way Propecia can be effective for male pattern hair loss. I also do recommend certain vitamin supplementations. As a dermatologist, I don't recommend taking biotin supplementation on its own unless you are biotin deficient. Biotin supplementation in a person who's not biotin deficient can actually mess with other laboratory values. Instead, what I recommend is vitamins that use blends of nutraceuticals to help stimulate hair growth. And my favorite ones are Nutrafol or Viviscal. Both of these have a blend of proprietary ingredients that help support thicker, healthier hair. Another important aspect of hair growth is making sure that there's no inflammation on the scalp. So I always examine my client's scalp looking for signs of inflammation. And this could be something like a condition called seborrheic dermatitis, where there's a yeast buildup on the scalp. They could have something called psoriasis or eczema of the scalp, where there's actually inflammation of the scalp. So it's really important to treat any underlying cause and make sure the scalp is healthy. So oftentimes I'll put my clients on a topical steroid if they need it, or on a ketoconazole shampoo such as over-the-counter Nizoral to bring down any inflammation or yeast overgrowth in the scalp. And for those that really want to hit this hard, because I always say that when you treat hair loss, the more modalities you include in your treatment plan, the better your results will be. I do a lot of what's called PRP injections into the scalp in my office for my clients. PRP is platelet-rich plasma, where we draw your blood, we spin it down in a centrifuge, and we separate the red blood cells from the platelet-rich plasma. And the platelet-rich plasma has all these cells and signals to help heal, and that will help to trigger hair growth. So it is not a quick process. It takes multiple treatments, but it really can help to thicken and regrow your hair. So there are multiple ways that I use PRP in the scalp. Oftentimes I will inject it into the scalp. I may also microneedle the scalp and then infuse it topically or injection as well. So the idea is to deliver those cells and signals to help that hair regrow. And then lastly, there is some evidence to show that the low energy light therapy caps that you can buy really do help to increase blood flow to the scalp, which can really help stimulate hair growth as well. So for my clients who want to do it all, I do recommend grabbing one of those low energy light therapy caps and adding that into your routine. You want to use it at least several times a week for it to be effective. The brands that I typically recommend are the iRestore, Current Body, or the Kepilus ones. So for any of you out there experiencing hair loss, my take-home message is that first, make sure you understand what the underlying cause of your hair loss is, and then seek treatment after that. It's also really important to understand that hair loss is what we call multifactorial. For most individuals, it's not just one thing. It's usually a blend of multiple things going on. So there might be multiple things that we want to focus on when we're creating the ideal treatment plan. So have patience and give it some time, because all of these treatments are going to take at least a few months to really kick in and show you what they can do. Do you have any hair loss tips? Share them in the comments below. And don't forget to give this video a thumbs up and subscribe to my channel. Thanks for watching.